I'm 38 years old, not able to conceive. What could be the reason?
Uh, the most important reason for not conceiving at this age is ovarian reserve. Sometimes after the age of 35 years, the ovarian reserve keeps going down. And then the quality and the number of the eggs are not sufficient to make pregnancy. So that could be one of the reasons.
Is there any test to check fertility?
Yes, at this stage we would advise you to undergo a test which is called AMH, anti-Mullerian hormone. If this value of this test is between 2 to 6, in case if it is less than 2, that means your ovarian reserve is less. Moreover, when we do an ultrasound, we see the volume of the ovaries, we see the number of eggs in it, and we see the vascularity. Collectively, all these things along with the age, the ovarian volume, the antral follicle count, the anti-Mullerian hormone will tell us what is your fertility as on now. What is your ovarian reserve, I would say.
Does that mean I have attained menopause?
No, you may get periods every month, but the ovulation doesn't take place, or it takes place very infrequently. The quality of the egg is not that great as it would have been otherwise.
Can I still wait for pregnancy even at the age of 38 years?
I would not advise, and rather I will discourage you to still wait if your age is already 38. See, what happens is, along with the number, the quality of eggs goes down. So it becomes very, very difficult in these cases. And moreover, if you find that your ovarian reserve is less, rather than waiting for normal cycle or IUI, I would suggest you to go for IVF straight away. Because in that IVF, we can stimulate your ovaries, we can get more number of eggs, we can fertilize them, choose the best embryo and put it in your uterus. So I would say that at this age, I don't think there's any scope of IUI if your ovarian reserve is going down, or any other method. I would strictly not advise you to wait.
Is there any method by which my number of eggs improve?
In case if your number of eggs are less and AMH is less and you are of a younger age, maybe if you are just 25 or 26 years and we find that your AMH is gone down and your ovarian number is less, yes, we can give you some kind of medicine. But if the number of eggs is according to your age, I don't think any kind of medicine will work. Still we can give for some time, but I'm sure that will not work well.
What are the options in case my number of eggs do not improve?
In case your number of eggs do not improve and you have undergone IVF, and if we see that you still make a good number of embryos, maybe 2 or 3 good embryos, we can do your self-cycle IVF. But in case if we find that your embryos are not good and your number of eggs collected are not sufficient, or if they are not fertilized, then you may have to take a donor.
What should I do if I want pregnancy with my own eggs?
You have to accept. You have to accept the success rate. If you want to have pregnancy with your own eggs and we just find 1 or 2 eggs, you can still go IVF with your own eggs, but obviously the success rate will be low. We find that success rate is more in younger age. If they undergo IVF treatment and the age is less, the quality of eggs are good. So we get a better success rate. But in your age, like 38 years, we might get 1 or 2 good embryos, but I don't think that we can get many good embryos.
In case I just do not have any egg, can I still get pregnant?
Yes, but you'll have to take a donor. What do I mean by donor is that some other lady is going to give her eggs and she's going to donate you. It will be fertilized with your husband's sperm and the embryos will be formed, and these embryos will be put back into the uterus. So you are going to get pregnant, but the eggs will be donated eggs. And these donors are basically people just accept it because 50% of the pregnancy is genetically from the couple, like sperms used will be from husband. Moreover, since the blood flow and everything will be, and you are going to deliver. So I would say, if not 100%, at least 70 to 80% the baby belongs to you.
How do you select a donor?
Basically, we are not allowed to select a donor from, like some people going around and we just choose a donor. We can't do that. We have to take donors from ICMR guided semen or the gamete banks. They give us donors. Those donors are basically investigated. We have already done HIV, Australia antigen, VDRL in that. and these do not have any pregnancy which is abnormal in their life. Like, we are supposed to take donor who already have a child, and we need to know about the family history of the donor. Then we match the donor. It should match height wise, complexion wise, and according to the build. Accordingly, we choose a donor.
Can I see or meet the donor?
No, that's not allowed. ICMR will not allow that you recipient and donor meet, or even they know and see the photographs also. You have to trust us. You have to give your profile. We see your profile and we match the profile of the donor. Then we select a donor and we try to take the best donor. Those who got a good number of eggs, those who have got a normal babies before, and those who are ovarian reserve is good and they are younger age group.
Do you match the donor's blood group?
Yes, we do that. It should match either with your blood group or maybe with your husband's blood group. We take such a donor. It depends. A couple of people say we don't bother, it's okay. But we give them a choice. Would they like to have a donor of their blood group kind or no?
What is the guarantee that the donor does not have any disease?
When we take them from a bank which are authorized to give us those donors, they are supposed to keep a record of these donors. They will be having a complete family history of these donors, and they are responsible for that, and they have to give a certificate that this donor doesn't have any abnormality in their family, and this donor is free of HIV, Australia antigen and VDRL.
Doctor, do I believe the baby born out of the donor egg will be absolutely normal?
Yes, there will be no variation because the eggs are from donor. Whatever the abnormality can happen otherwise, it may happen, but not because of the donor at all.
Thank you, doctor.
Thank you so much.